Hi, everybody. Dr. Rafich here, continuing through this issue of JAVMA, October 15, 2016. And this is a cool paper. It comes out of, actually, the hospital I used to work at in Campbell, California, amongst a company here and a laboratory. But this is multiple gastric erosions diagnosed by means of a capsule endoscopy in a dog. So it is only a case study, or a case report rather. Here's what we're talking about. They have a capsule that is small enough to ingest. This is obviously a person. And in the capsule, it has a battery, an antenna, a lens, lights. Basically, it's got a mini camera. And what it does is it records the transit through the gastrointestinal tract. You then poop it out and clean it off and then give it to the company, and they will download whatever the images that they saw in your stomach and intestines. So it's a minimally invasive way. It's not even invasive. It avoids the need for scoping in people and in animals. So pretty cool. So this is a report, and here are the images that it plays out. We'll go into details here about what these images show. 6-year-old female spayed golden retriever, 2 weeks of progressive hyporexia, abdominal pain, weight loss. They found some pain on palpation of the cranial part of the abdomen, and the dog had a poor body condition score. A complete blood count showed mild microcytosis, meaning the red blood cells were smaller than normal in size, and hypochromasia, which means the red blood cells were more pale than typical. Biochemistry panel was normal, abdominal ultrasound was normal. They performed the capsule endoscopy. Numerous gastric erosions and hemorrhages were detected with rare dilated lacteals, so the lymphatic system, in the proximal aspect of the small intestine. They treated the dog with omeprazole and sucralfate for 6 weeks and a novel lamb protein diet. They repeated the capsule endoscopy at that time. There was improvements. They continued treatment for another 2 weeks, and by 9 months, dog was normal. They also did perform a urinalysis, serum thyroid hormone evaluation, including total and free thyroxine and thyroid-stimulating hormone concentrations, as well as fecal flotation and Giardia antigen by ELISA, and those were all normal. In preparation for the capsule, food was withheld for 24 hours. The dog was allowed water. Capsule was administered orally. Food was withheld for another 8 hours. They monitored the feces, and 24 hours after giving the capsule, it passed. There were 9,500 total images from the capsule that were downloaded. The transit time was calculated by the software program by using marked images and corresponding elapsed time since capsule activation, which is automatically recorded by the capsule. The gastric transit time for the capsule was 22 minutes. Small intestinal transit time was 140 minutes. And the reference ranges for transit times have not been established with this technology. The owners were instructed to administer medications 2 hours apart and deliver sucralfate as a slurry. They had started the lamb-based novel protein diet. Here is a close-up of the images. The top image, A and B, shows the mucosal erosions and hemorrhage. And then C shows a fissure in the jejunum. D shows a little white dot in the middle there. That's not a reflection, as dilated lacteals in the small intestine. And then this is the recheck 6 weeks later, showing marked improvement of those structures. The owners declined a third capsule endoscopy procedure to assess the patient, but by 9 months, dog was normal. Discussion. The device used in the patient described here consists of a battery, a white light emitting diode light source, 4 auto-focusing cameras, a microprocessor, internal image storage system, contained within a translucent biocompatible plastic capsule that measured 11 by 31 millimeters, weighed 4 grams. It could capture 360-degree panoramic images up to 5 times per second. Battery life 15 hours. In addition to downloading images, the software allowed for image playback at variable speeds up to 8 times real time. Still and video image capture, image magnification, variable image display configurations, red color detection to detect bleed, generation of a report describing images, findings, and recommendations. Alternatively, the manufacturer provides image download, analysis, and report generated by small animal internist. The capsule endoscopic studies of human patients. The time typically required to review the images has been between 40 to 60 minutes, depending on their expertise and experience with looking at these images. Wild. Commonly reported causes of GI ulcers and erosions in dogs include medications like nonsteroidal anti-inflammatory drugs and steroids, severe systemic disease like sepsis, shock, disseminated intravascular coagulation or DIC, liver failure, chronic kidney disease, eosinophilic or lymphoplasmacytic inflammatory bowel disease, extreme exercise, neurologic disease, mast cell tumor. Less commonly, infectious agents are involved, which include fungal, bacterial, viral, parasitic. Caustic substances and other cancers have been implicated in dog ulcers. They did not perform biopsies in this case. Clinical pathologic abnormalities include anemia, low protein, high BUN, which can support GI ulcerations. Regenerative and non-regenerative anemia have been reported and hematologic evidence of iron deficiency has been identified in small numbers of dogs with gastroduodenal ulcers. Contrast radiographs and ultrasound can also be used, but gastroduodenoscopy is the most sensitive method. Disadvantages for scoping include general anesthesia and that your exam is limited to stomach and proximal duodenum, as well as the need for extensive training and expensive equipment. Treatment of GI ulcers and erosions in dogs consists of gastric acid suppression, cytoprotective medication, and treatment or elimination of the primary cause. However, initial treatment is routinely recommended for 2 to 3 weeks. Proton pump inhibitors have been shown to be more efficacious than histamine 2 receptor antagonists for acid suppression in dogs and are recommended for this purpose. Sucralfate facilitates healing and acts as a cytoprotectant by binding to ulcerated areas of mucosa, limiting further acid and enzymatic penetration into damaged tissue. Sucralfate has been shown to stimulate gastric mucus and bicarbonate production through prostaglandin-dependent and non-prostaglandin-dependent mechanisms, and to increase epidermal growth factor-mediated cell renewal. Severe ulceration can perf and cause septic peritonitis. Despite surgery, prognosis is guarded in these cases. Capsule endoscopy in humans. Use of this method has been expanded to include the evaluation and monitoring for patients with iron deficiency anemia, inflammatory bowel disease like Crohn's disease or ulcerative colitis, small intestinal tumors, polyposis syndrome, celiac disease, nonsteroidal anti-inflammatory disease-related enteropathy, and abdominal pain. Technological advances have made it possible to evaluate the esophagus and colon with capsules. The most common complication of the procedure in people is retention, defined as failure to pass the capsule within 2 weeks after ingestion. The overall retention rate has been reported to be 14 of 1,000 or 1.4%, with variations depending on the presence and type of underlying disease. So 0% retention in healthy people, 21% if they have obstruction. Capsule retention has most commonly been reported in people with neoplastic diseases, Crohn's disease, or a history of nonsteroidal anti-inflammatory drug use, both of which commonly cause strictures in people, or postoperative adhesions causing a narrowed bowel. Medical treatment such as promotility agents, endoscopic retrieval, or surgical removal may be necessary if there's retention of the capsule. Capsule aspiration and perforation of the gastrointestinal tract by retained capsules have been rarely reported. Therefore, contraindication to capsules include gastrointestinal obstruction and swallowing disorders. The small patient size may be a limit of passing through the GI tract, but it has been used in infants as young as 10 months old, weighing as little as 7.9 kilograms or 17.4 pounds. Reports of capsule endoscopy in veterinary literature is sparse. Incomplete evaluations were reported in 3 of 18 dogs in one study, so 17%, although repeating the procedure resulted in complete evaluation in all 3 of those dogs. In another study, dogs used were small, so mean weight of 6 kilograms of 13.2 pounds. All of them passed the capsule within 27 hours after administration without any difficulty. Bowel preparation can include polyethylene glycol and simethicone, but consensus on the optimal preparation has not been reached. Oral administration of polyethylene glycol results in better capsule endoscopic images quality and in a small number of healthy dogs than did 0.9% sodium chloride, particularly in the distal portions of the GI tract. Fairly large volumes were required. like 25 to 30 mLs of polyethylene glycol solution per kilogram. Wow. Or 11.4 to 13.6 mils per pound given twice, which could potentially affect tolerability for some patients or perceived invasiveness of the procedure for owners. Other studies have shown adequate image quality after fasting alone, with no difference in results after fasting for 24 to 48 hours. And they finally mentioned that CT scan and MRI can also be used as additional imaging modalities. Crazy. That's awesome. Obviously, we need large studies to see this further, and then, of course, from there go into specific diseases. But I love studies like that. I try new things. That's pretty cool. Pretty cool. All right. Thanks to those who support the channel. We'll see you again tomorrow. Bye-bye.